Welcome to MedicoApps Masterclass. We'll be learning today about the anatomy of the middle ear. So as you can see in this picture, the middle ear is a 6-walled cavity. The medial wall is a common wall between the middle and the inner ear. Okay. The lateral wall is a common wall between external and the middle ear. So medial wall is between middle and inner. Lateral wall is between external and the middle ear. The anterior wall separates the middle ear from the pharynx. Okay. Middle ear is separated from the pharynx by the anterior wall, and the posterior wall separates it from the mastoid. And finally, the roof separates the middle ear from the middle cranial fossa. Okay. So this is how the middle ear looks. We'll understand each of these structures in detail. Let's start off with the medial wall of the middle ear. The first important structure we're looking at is the promontory. Okay. So this is the promontory that you're seeing, and it is a bulge that is produced by the basal turn of the cochlea. By function, it helps in sensing the sounds of high frequency. So promontory helps in sensing the sounds of high frequency. Okay. Now, the next structure we are looking at is the oval window. Okay. It is covered by footplate of stapes. So this is the oval window, and we know that footplate of stapes is something like this, right? So it covers the oval window, and oval window connects to the vestibule. It connects the middle ear to the vestibule. Now the round window is covered by a secondary tympanic membrane. See, this is the round window, and it is covered by a secondary tympanic membrane, and it connects to the Scala tympani. Okay. The next structure is the lateral semicircular canal. It forms a bulge on the medial wall. You can see this is the bulge that is formed on the medial wall due to the lateral semicircular canal. The next important structure is Processus Cochleariformis. Okay. So here is your Processus Cochleariformis, and it is a projection of bone from the cochlea. Okay. The tensor tympani muscle takes a turn and moves laterally and attaches to the mandible. Okay. This is the tensor tympani muscle which is taking a turn over here, and it will go and attach to the handle of the mandible. This Processus Cochleariformis acts as a landmark for the first genu of the facial nerve, and also the geniculate ganglion is present on this first genu. Okay. So here is your geniculate ganglion. It is present on the first genu of the facial nerve, and Processus Cochleariformis acts as a landmark for this. Okay. Now, the facial nerve is the next important structure. It enters the medial wall at the first genu. We have seen that. It has a horizontal or the tympanic segment which is present in the Fallopian canal. See, this is the Fallopian canal. It is present above the oval window and below and lateral to the semicircular canal. You can understand the anatomy. This is your semicircular canal, and this is the oval window, and here lies your facial nerve within the Fallopian canal. So on the whole, this is how the middle ear appears. These are the semicircular ducts. This is the semicircular canal. Here is your vestibule. This is the tympanic membrane, obviously. This will be your external ear. These are the cochlea and the cochlear ducts. Here is passing your facial nerve, and this is your 8th cranial nerve. Now let's proceed to the posterior wall of the middle ear. Okay. So this is the posterior wall. This is how it looks. See, this marking is, this entire wall is my posterior wall of the ear. Let's understand all of these structures in detail. The first one we are looking at is the adytus. Okay. The adytus to the mastoid antrum is present like this on the posterior wall. Okay. It is acting like a ventilation for the mastoid, and because it is ventilation, obviously it will bring along with it some infections also. So it is a very important source of spread of infections within the ear. Okay. So here is how the facial nerve is passing. We have previously seen. Here is the adytus. That's nothing but a ventilation of mastoid. The next structure is the facial nerve. So the facial nerve, the horizontal segment passes from the medial wall, takes a turn at the junction of the medial and posterior wall, and then runs vertically. Okay. And this segment is known as the vertical or the mastoid segment of the facial nerve. So in this image, you can see the facial nerve is running vertically over here after passing through the junction between the medial and the posterior wall. Now the next important structure is the chorda tympani. It has its opening at the posterior wall. As you can see, this is the entry of chorda tympani nerve. Okay, it passes through the middle ear and exits via the anterior wall. Okay, so it enters via the posterior wall, passes into the middle ear and exits via the anterior wall. The next important structure is fossa incudis. Okay, it lodges the short crus of incus. So fossa incudis lodges the short crus of the bone incus. Okay, next we are looking at the facial recess. So look at this image over here. Medially, it is formed by the vertical segment of the facial nerve. So this is the facial nerve and the vertical segment that is passing behind, we cannot see that in this image. The vertical part of this facial nerve forms the medial part of the facial recess. Laterally, it is formed by the entry of the chorda tympani. See, this is the entry of the chorda tympani nerve, and superiorly, it is formed by the fossa incudis. Okay. Facial recess is also known as suprapyramidal recess, and it is an important part for the placement of cochlear electrodes. So this is your facial recess located over here. Here you can see this part is the facial recess. Medially, facial nerve is present. Laterally, the chorda tympani nerve is present, and superiorly, the fossa incudis is present. So facial recess is also known as the suprapyramidal recess, and it is an important part for the placement of electrode. Now, the next structure is sinus tympani. It is known as infrapyramidal recess. Okay, it is a hidden area in the middle ear. Okay, as you can see, and it is the most common site of residual disease of cholesteatoma. Okay, this sinus tympani or the infrapyramidal recess is an important site for cholesteatoma. So the next structure is the pyramid, and the stapedius muscle originates from the pyramid. You can see this is the pyramid and the stapedial muscle is originating from that structure. So the stapedius muscle insertion is into the neck of the stapes. You can see this is the stapes bone and stapedial muscle is inserting onto its neck. Now let's proceed to understand the stapedial reflex. We have seen in our previous class a little bit about stapedial reflex. So when the sound threshold is within 70 to 100 decibels, the external auditory canal, it passes through the external auditory canal into the middle ear to the organ of Carti and stimulates our auditory pathway. This entire process up to here, we are calling it the afferent pathway. When we look at the efferent pathway, in the ipsilateral ear, the facial nerve is stimulated, which in turn stimulates the stapedius, resulting in the stapedial reflex. Also in the contralateral ear, facial nerve stimulates stapedius, resulting in the stapedial reflex. This entire pathway is referred to as the efferent part of the acoustic reflex. Now, what is the importance of this reflex? It protects the inner ear from noise trauma. The afferent is 8th nerve. The efferent is 7th nerve. Okay. The 8th nerve, when there is a palsy, obviously stapedial reflex is absent in both the ears. However, if there is 7th nerve palsy, in that ear only the stapedial reflex is absent. Okay. So when there is an 8th nerve palsy, stapedial reflex is lost in both the ears. In 7th nerve palsy, only in that side of the ear there is a stapedial reflex loss. Okay. It is used for testing non-organic hearing loss. Stapedial reflex, please remember, it is used to find out malingering in patients. Now, pars flaccida is the most mobile part of tympanic membrane. It is the most common site for a retraction pocket. We all are familiar with this. Okay. Is mesotympanum, measures about 2 millimeters, and the widest part of the middle ear is the epitympanum, which measures about 6 millimeters. So narrowest is mesotympanum, widest is epitympanum. Now let's look at the anterior wall of the middle ear. Okay, the anterior wall is also known as the carotid wall. Okay, so this is the anterior wall we're looking at. It has three major structures. That is the opening of the eustachian tube over here, the opening for the chorda tympani nerve over here, and also there is the origin of tensor tympani. Please remember these three structures. You can remember it as TEC. Okay, T is for tensor tympani, E is for eustachian tube, C is for chorda tympani. The chorda tympani goes through the canal of Huggier. Okay, please remember this name. Canal of Huggier helps in passage of the chorda tympani nerve. Now let's look at the roof of the middle ear. The important structure we are looking at here is the tegment tympani, and it separates the roof from the middle cranial fossa, mainly from the temporal lobe. Okay, so tegment tympani separates middle ear from the temporal lobe. Please remember this. Tegment tympani separates middle ear from temporal lobe. Let's proceed to the floor of the middle ear. The important structure we are seeing here is the jugular bulb. Okay, the floor is mainly formed by the jugular bulb, and the nerves 9, 10 and 11 cranial nerves pass through it. Okay, the Jacobson's nerve enters the middle ear through the floor and forms the tympanic plexus. You can see here, these are the tympanic plexus on the promontory. This is formed by the Jacobson's nerve, and this passes via the floor of the middle ear. Okay, now let's proceed to the cavity of the middle ear. It is divided into three parts: the epitympanum number 1, the mesotympanum number 2 and hypotympanum number 3. Okay, now epitympanum, mesotympanum and hypotympanum are the three parts of the middle ear cavity. So another important structure is scutum. What is scutum? Scutum is present above the pars flaccida of the tympanic membrane. It forms the lateral wall of the attic. Okay, you can see here it's forming the lateral wall of the attic. Now, Prusac space is another important exam related bit. It is the most common site for primary cholesteatoma. Please make a note of this point. It is the most common site for primary cholesteatoma, that is Prusac space. It has been very frequently asked in the exam. And it is an area that is medial to pars flaccida.